Hey, welcome back. I'm glad you all came back today. I just want to say really quickly, I appreciate you. Coffee and bagels in the back, and I want to introduce Heather Reutels from the Office of Substance Use and Mental Health.
Good morning, everybody. How's everybody doing? You do need sunglasses up here, right? I just want to, I'm Heather Reutels. I'm the Certified Peer Support, or the Recovery and Resiliency Peer Support Program Manager with the Office of Substance Use and Mental Health. I'm also the Certified Peer Support Specialist, a Family Peer Support Specialist, and a woman in long-term recovery. And for me, that means that I haven't consumed any alcohol, abused any prescription medication, used any illegal substances since August 9th, 2009. And I also take care of myself, self-care, and take care of my mental health since then. And I'd like to welcome you to the second day of the 2023 Peer Conference, Building Hope Together. And I always love this conference because I get to see so many folks in person that I sometimes talk to on the phone or share emails, and I also get to connect with friends. And there's always so much great energy here. And I love this year's theme. After 30 years of addiction and bad decisions and trying to change on my own for so many years and never succeeding, I had lost all hope. And then in 2009, when something clicked, I realized that I needed to ask for help. I couldn't do it alone. That was a struggle, but I finally was able to get into treatment. And the first time that I walked through the doors of House of Hope, that was the first time that I felt an overwhelming sense of hope. I knew that my life was going to be different. It wasn't easy, but I succeeded. I successfully completed residential in 2010 and outpatient in 2011. And now I get to be part of the peer movement in Utah, expanding peer support and building hope together. Because to me, that's what peer support is. And then I want to share some of the growth with peer support over the years. So the number of adult peer support specialists trained last year was 204. As of this year, we have 259, and we'll have 50 more with the 2 trainings coming up with Optum and USU. Latino Behavioral Health was the first agency to provide Spanish training, so thank you for that. And we now have 8 agencies with contracts that provide the peer support training. And then in 2021, after Allies closed their doors, we lost many of our family peer support specialists. We ended up with like 20 or 25. So we're working on building that back up. And I think we have over 200 now. And then we also have created a dual training for those that are already certified peer support specialists. They can take an 8-hour course if they have the lived experience of being a caretaker or a parent of a child that has struggled with mental health or substance use. So they can be dual certified. We have had 2 agencies come in and provide our first forensic peer support training, and we are now currently working with Peer and Family Career Academy to finalize the Utah curriculum. So I'm hoping that that will be created and ready to go in October, at least by the end of the year. And for the first time since 2016, we'll be offering Dimensions tobacco cessation training in fiscal year 24. So for those that want to provide those classes. We're also writing rule and developing criteria for an advanced peer standing certification for experienced peers that have demonstrated understanding skills for the SAMHSA peer core competencies, And then I just want to remind everybody that you can count this conference towards CEUs. I think we have some blank tracking sheets up front if you need those. And if you will have certificates at the end of the conference, and it will outline how many CEUs are possible, and then just fill in the blank, and we just kind of use the honor system like we always have. So anyway, thank you and enjoy the conference. It's great to see everybody.
Thank you, Heather. I want to take a few seconds to thank our sponsors. As you can see on the screen and the TVs on the side, we have secured some great partners in the community that help us put this conference together. And there's two of them that I want to give them a few minutes to speak to you. I want to invite up Brian Nielsen. Come on now. Give it up for Brian.
What's up? So I'm Brian. I think most people know me. I don't want to spend too much time on introductions. I've been in recovery since 2009. I've been doing peer support since 2011. I've been training since 2012 or 13 for the USU's Certified Peer Support Training Program. I'm currently the Executive Director of the Utah Association of Peer Support Specialists, and it's kind of why I'm up here. So the first thing I want to do is, if you're a peer supporter, why don't you just stand up for a second? Now why don't you give yourself a hand, because you all are... For me, this shirt really stands true. CPSS is badass miracle workers, and every one of you guys. And I've worked with so many of you across the state that it's been a blessing to me to just be a part of this journey. Watch the workforce grow, watch these conferences get bigger and bigger. Work with so many different agencies to do apprenticeships, practicums, learn new supervision skills. It's been a blessing. So give yourself a hand on that. So an association is a group of people, right? Utah Association is nothing more than that. It's not about me, it's about you. Our mission is to guide peer support services where you and your peers feel like it should go. Not where I think it should go. We're also trying to provide more dual disorder services or mental health services. Substance use has really got a strong hold. We need way more on that dual disorder side of things, so we're working heavily in that area. And then my commitment to you guys is the last part of our mission. We're going to continue to advance peer support across the state. I work closely with Heather and all the rest of the teams out here, Latino, all of them. And we're aiming at big horizons. We'll be in the jails. We got people working in the prisons already. We're going to amp up the youth parts. We got family peers that are growing like crazy. And we're just going to keep continuing to advance peer support across the state. So that's a little bit about us. I'll bring my cards around. I'll throw a pile of them on your guys' tables. We got some brochures that I'll throw around. Our location is down the same place as Latino. If you guys want to stop in and say hi, I do. I value you. This isn't about me. This is about the association of all of us bonding together, bridging the state, and just making things better like you've done for the last 10 years. So thank you.
Thank you, Brian. I just want to say to you guys that Brian just moved into a new space. So they have a beautiful space right downstairs. No, right? Across the hall from me. Yeah. Downstairs, upstairs, I don't know. Across the hall from me, so we're creating a hub. So if you stop to say hello to them, come say hello to us too. And then, just so you know, there are some great agencies that are coming up and we're working very hard to create momentum and to support all of you, all of us as peers, to make sure that the movement continues and grows across the state. We couldn't do what we do without the support of some of the sponsors, and one of them is the University of Utah. And I want to welcome Lupe here, that wants to say a few words as a sponsor.
Awesome, thank you. Hi everyone, good morning, happy Friday. We are one of the sponsors, University of Utah Health Plans. My name is Lupe Figueroa and I am a community outreach coordinator. We love the partnership with Latino Behavioral Health. We love to support what they do. They do amazing things in the community. One of the things we do as community outreach for University of Utah Health Plans, we connect communities to resources about Medicaid. As we know, there is a lot of new arrivals coming to the state, and the insurance terminology can be confusing. So we like to help them with terminology and connecting them to resources within the University of Utah. Even if they don't choose our plan, or if they're not eligible for a plan, we want to help them out. We refer them to Latino Behavioral Health. We refer them to other organizations within the U. We do have a booth over on the other side. If you know of anybody that that can't afford any eyeglasses, we can definitely connect them to the Moran Eye Center. They actually hold clinics every 3 months on Saturdays, and they can give free examining glasses to individuals that cannot afford to buy glasses. So if you know any family that is in need of this service, definitely come reach out to me. I'll definitely take your information and I can connect you. We are out in the community, again, advocating for health for everyone. And again, as an insurance company, they don't really want to talk to us because they feel like we're going to want to sell them something, but we're not. The main focus is to have them, learn about health insurance, regardless if they choose our plan or not. We want to make them sure that they are connected with the right resources they deserve. And we want to be able to help everybody in the community. We do have a lot of videos in several languages for University of Utah Health Plans that talks about what is health insurance, because it is really confusing, and we have them in up to 12 languages. Some of them include Spanish, Chinese, Swahili, Arabic, and so on. So I do have that information. If anybody is interested, we can definitely share the links to our YouTube page, and we are still currently working and getting more materials in different languages, and that's something we want to continue to work on and help other communities have those resources in their native languages. Again, my name is Lupe Figueroa. I have a booth on the other side, and I am the one that's giving out the Everybody is Welcome stickers. I hope everybody has been liking them. I also have cups. Thank you so much for your time, and thank you so much to everybody in Latino Behavioral Health for everything they do and all the amazing things they do. Thank you.
I just want to remind everybody that with hope, anything is possible, and with us building hope together, we're unstoppable. So I just want to introduce Brent Kelsey. He is my boss. He is the director of the Office of Substance Use and Mental Health, and he's also a great leader and a great friend. Please give a warm welcome to Brent.
I want to thank Heather too for the leadership that she shows in building out peer support in Utah. Heather, you're the leader in our office. My name's Brent Kelsey. I'm the director of the Office of Substance Use and Mental Health, and I'm really glad to be here in person. Last year, I was asked to speak at this event. I was under the mistaken impression that it was all virtual, and so I was sitting on a Zoom call waiting to get moved into the room, and you were all in this room waiting for me, and for that I apologize. And I also want to say that I was treated with grace when that happened. And I really appreciate that. I don't know of a more empathetic professional group than the peer support specialists that I work with through the Office of Substance Use and Mental Health, and I want to thank you for the work that you do. What a great agenda. I was able to look at it this morning. I've been talking to people. I hope that you were able to participate yesterday, and I hope that you're able to stay today. Fantastic offerings that will improve the quality of peer support services in the state of Utah. So congratulations to the conference planners. You put together a fantastic event. I also want you to know that peer support specialists play a critical role in our behavioral health system. And by sharing your stories and through your lived experience, you reduce the barriers that people face that prevent them from recovery. And what barriers am I talking about? Well, for one, stigma. And I know that Owen's going to do a breakout later on about stigma, but to me, stigma is one of the primary issues that we need to address in the state of Utah. There's structural stigma. We have laws and policies that prevent people with substance use disorders and mental health concerns from living a full life in the community, and we need to address that. And then we also have internalized stigma. There's too much shame associated with substance use disorder and mental health disorder. And we need to help people recognize that recovery is possible and that this is not something to be shameful about. And you do that every day by working with people, sometimes when they're at their lowest point. And you bring hope, which is so important. I wanted to let you know about 3 things that are happening at the Office of Substance Use and Mental Health that I think that I want you to be involved in, frankly. First of all, we're working with the Huntsman Mental Health Institute and the Huntsman family on the Stop the Stigma campaign. And I think Owen's going to talk about this a little bit later. But if you're not involved, Google it and get involved. This is going to be a national campaign to reduce stigma, and I think it's really important. And it'll change the conversation about substance use disorder and mental health in this country. The second thing I wanted to talk to you about is next week, we've been working with the Utah Substance Abuse Advisory Council in the governor's office, the Kim Gardner group at the University of Utah, the Utah Hospital Association, and Levitt Partners, and we'll be releasing our behavioral health master plan. This plan is designed to guide the development of Utah's behavioral health care system for the next 5 to 10 years. And it's the result of more than 40 focus groups. There have been about 300 people that have been involved in the development of this plan, and countless hours have been spent putting it together. But you know what? It's not perfect. We're releasing it in draft form. And I hope that we can get a draft to all of you, and you can weigh in and tell us what's missing or where we've missed the mark. The idea is we're going to circulate this draft over the next few months, and then in September, we'll finalize the Utah's Behavioral Health Master Plan. Why do I bring it up here? Because critical to my vision is we need to partner with people in recovery. And we need your input and your voice in all of these efforts to make sure that the service delivery system that we develop meets our needs, okay? And so I'm hopeful that you'll get involved in that effort too. And then the third thing I wanted to talk about is our office's efforts to partner with people in recovery. So we're developing a strategic plan. That's one of my primary strategies. And I want to make sure that peer support, that recovery support services, and other services that are designed to help people improve their health, build community, find purpose, are critical parts of that plan. So we'll be reaching out to you and working on initiatives to further peer support, recovery support services, housing initiatives, and other issues that we know are so important to people trying to find recovery or in recovery. I want to thank you for giving me a few minutes to speak, and I also want you to look to me as a partner. The best ideas will not come from us, they will come from you. So feel free to reach out to me at any time when you have a new idea, or if you identify a challenge that you think needs to be addressed. I want to be your partner. And thank you for the opportunity to say a few words. Thanks to the conference planners, and have a great day.